Welcome, everyone. I'm excited to welcome you to this episode of the Sunflower Podcast, a podcast exploring all aspects of children's palliative care around the world. Sunflower Podcast is going to bring curiosity, humor, and reflection to the world of palliative care. We love exploring the joys and challenges of working in this incredible field, including topics related to education, advocacy, self care, service provision, and leadership from around the world. Whether you're a nurse, counselor, pharmacist, doctor, or any other type of health worker, or just someone who's interested in learning more about children's palliative care, then this is the podcast for you. I am one of your hosts, Dr. Spandana Rayala, and today I'm joined by Dr. Krithika Rao, a specialist in palliative care and has a special interest in pediatric palliative care based in Manipal, India. So let's get started. Hello, Krithika. Wonderful to
Hi,
have you with us.
hi, Dr. Spandana. Thank you so much for having me here.
Can you tell us a little bit about your journey in palliative care and how it brought you into this world of pediatric palliative care?
Wow, that's like an interesting question because you just made me reflect back into a long time ago. When I think about it, I just realized that it began long before I even knew that this specialty even existed. Because as a child, my parents would often visit our family physician and a very good friend of my father. And I would often watch my uncle. I mean, I used to call him uncle in his clinic. And what stood out to me was that it wasn't just medicine, that knowledge that he had about when he practiced and when he would see his patients. It would be that compassion that he would bring out, and with that sincerity that he would see. He knew those patients beyond their diseases and their diagnosis, and he understood, where they come from, what would have been their struggles, and the lives that they live. What struck me was that the way he cared for them, he would show such amount of humility. He would be very empathetic towards them and so sincere that that was something that left a deep impression on me. And that's when I understood what was medicine is not just about curing but also about caring. So that he was my inspiration to get into medicine and medical school. So in my early years of training in medical school, I began to see that realities of inequalities in healthcare, because I've worked both in urban hospitals and rural settings where I finished my med school and then I joined in my postgraduate residency training. I saw that, a lot of these patients came with advanced illnesses, often, taking long journeys to come in from far and wide places, limited resources, very little support. And I just saw that their suffering just extended beyond physical pain, more of, the emotional distress that they would go through because of the uncertainty of the illnesses, and also that entire social isolation they would feel by going through this on their own accord, and they didn't know where to go, what to do. During medical school and after that, I had some time where I was giving my exams to get into a postgraduate training. And that's where, when I again went back to work with my uncle at his hospital, I came across by chance a conversation with a senior oncologist. And that's where I came to know about palliative care. When I learned from him that this field was dedicated to caring for patients with serious illnesses, more looking at quality of life, not just focusing on the disease, but the person as a whole, that is something that resonated deeply with me. And I felt that, this is what, I believe that medicine should also be, not just looking at a disease. Luck, played by my side as well. When I applied for my postgraduate residency training program, we have a formal all India exam and then a counseling process. As luck would have it, as I said, I found that seat in Tata Memorial Hospital, and that's where my journey into palliative medicine began. And it has been a privilege to be part of that transformative process from then on. It's been 10 years, so I feel really lucky to be in this field and being through one of those vulnerable moments of the patients that we care for and learn from them.
Wow, that's a whole person approach that you have learned from a role model and now you're role modeling it to the next generation. That's fantastic. And also, I was thinking about the chance encounters that change our life. Thank you, Kritika, for that. I think the adult palliative medicine MD that you have undertaken at TMH has adult component, a bit of pediatric component, but at Manipal, Kasturba Medical College and Mahe, you are leading the pediatric palliative care part. So how did that shift happen? Do you still practice adult palliative care or do you focus only on pediatric palliative care? How does that work now?
Actually, that's the most interesting part because it started in my residency itself, where during one of our training sessions, and we used to have clinics, and alongside doing adult palliative care, my turning point was actually when I started began working with children. I've always had the love for pediatrics. I don't know, but families would tell me that I gel along well with kids. I can, be able to understand, play with them, or they would feel comfortable with me. And so some things that, during my residency training, sitting down with parents, being with the kid, trying to understand, that is something that pulled me closer towards that field. And I realized that as adults, patients can tell what is going wrong with them. They can express it out and seek help. But as a child, they are scared, they don't know what to do. And if someone can understand that perspective, can, really reach out to them and help them out, is something that would be really meaningful. And it really reflected back on me when I felt that is something that is I would really feel good about it if I have helped that child and the family get some relief from what they're suffering through. It would really make a world of a difference. And caring for children has been really profoundly humbling because you see that their resilience is extraordinary even in the midst of their hospitalizations. I would see in Tata Memorial Hospital, it was a crazy number in the hospital. They would come in and out for treatment daily and go. That would be such a difficult phase for the child to face, but still through that, they found their ways to laugh, to play, to do things. And that showed incredible strength and courage, which when I moved out from Tata Memorial Hospital after finishing my postgraduate training, and I worked for a year in there at Manipal, it gave me the opportunity that I could set it up as a service. And one of the things that helped me was my friendship with the pediatric oncologists here, who were also my colleagues at Tata Memorial Hospital. So it would just be that when we met at Manipal, they felt that it's something that it is just probably destiny that we're all here together, and we could make such a difference for the children that we care for here. So I do see both adult and pediatrics. It's equal distribution of my time because we are a very small team. We started very small with just 3 consultants, but now in these 8, 9 years, we have grown on to become a bigger department. But however, it has taken a lot of time for us to build that pediatric palliative care services. So we are well integrated with pediatric oncology, where I think the pediatric oncologist tells us that we need you here right from the beginning for every child. We cannot imagine that child undergoing cancer treatment does not get seen by a palliative care professional. So that has been very assuring for me that what we brought in as experts in palliative care for these children, as well as a team that relies on us and trusts us what we do.
Wow, having that early integration in pediatric palliative care is a huge win, and especially in tertiary hospitals, demonstrating the impact of the services. I think that's fantastic. I also agree with you that as heartbreaking as pediatric palliative care is, I think all of us who practice pediatric palliative care are so satisfied with our job, with what we do on day-to-day basis. Thank you for sharing that. And also the story you have told about having trained together with the oncologist, then being able to work together. I was thinking it's not just the social capital that must have helped you set up the program well. It's about their exposure to seeing what palliative care can do for these children, how it can improve their quality of life. That is the other thing I was reflecting on.
Yeah, actually, to add to that, the introduction to them feeling that they need us more started once because a chance conversation that they referred a child to us who had relapsed, and they were not able to, get across to the family because they were very hopeful and they wanted treatment. And we stepped in. And I remember sitting with the family during that difficult conversation, and I just requested one of the pediatric oncologists that would they mind being present here, because that would really make an impact for the family as well, that they do not just transfer it to us and we have separate conversations. Rather, can we look at having a common room that we can sit together and all of us talk to the family? And that conversation helped them understand what is happening, what as palliative care professionals could bring in for their team, how we could help them navigate conversations with parents who are finding it very difficult to take decisions, what to expect and how can care planning be done. It was like a very revealing moment for them that, oh my god, that it is so much beyond just providing cancer treatment. It is so much of planning of what should be done, how it can be done, and how things can be conveyed. So that one conversation changed their practice.
That is so wonderful to hear. Family meetings, especially bringing in multidisciplinary teams, is always challenging, but again, done well, it's very, very rewarding. Kritika,
Absolutely.
you have established yourself as a leader in the context of Indian but also global palliative care arena. So I was just wondering what made you consider applying for the leadership program run by Towards Cancer Collaboration? What was your project that you wanted to do, and what is the overall impact that you have achieved over the project duration?
It was an interesting conversation that I was having with my mentor, my guide, about I was stuck in where I was working. We were trying to expand services. And one conversation felt where he said that, Kritika, sometimes you may have the skills, but you don't have the opportunity or the right time. And sometimes you may have the right time, but you don't get the opportunity in hand walking into your place. And right about that conversation, I we were somewhere looking up about developing pediatric palliative care into a research project, and we're seeing how we can show what we do and how within the context of our country we can start building up our own practices, because we try to bring in results from the west, but because of our different cultural barriers or differences, I would say it does not always translate into the same way, and we cannot apply it in the same way. And I saw this post about leadership course in palliative care, and that's when it struck me when he said that, when you want to build the skills and you get the opportunity and it's the right timing, it all comes in together. And that's your sign that you should take that path forward. So that's what I did. I applied and I went with a very broad mind that I need to do something beyond just providing clinical medicine, because unless I don't be part of the system that can help towards making changes into the structure, the processes, just being a clinician won't suffice. I need to understand to go down to that level where change is possible being part of the system. And that's what made me feel that I should get into this leadership course. And that has been very impactful in the way that I built up my skills. And I learned about so many nuances of what it is to be a leader and develop those or hone those skills that probably were somewhere hidden, but I could sharpen them, work on them, overcome my fears, and the journey says it.
Yeah, fantastic. I like what you have said. A lot of the times we do know them, we do have them, the skills of being a leader, but it's also the practice of it, the intentional practice, the intentional honing, the intentional application of those skills, and sometimes structured programs help us with that. Can you tell us a bit about what your project was and how did these leadership skills help you successfully complete your project?
My project initially was very broad. My vision was actually to see that can we have a pain-free experience for children undergoing cancer treatment. And then I realized that that's a really vast vision that I have. I had to scale it down to achievable results over a period of 1 year of my leadership course. So having conversations with all the mentors as part of the leadership training program, I brought it down to thinking of looking at procedural pain, because when I would go for rounds in the wards with the pediatric oncology team, one of the things that really bothered me was the multiple needle stick procedures and seeing those children cry, and the parents would be hassled about how to manage it. And this would happen repeatedly. I know how much I also fear needles at this age, that I can imagine what the child would be going through. So I thought of looking at, can I bring in practice of managing procedural pain a much better way? My mentor give me that idea that having structured principles of managing procedural pain. At the same time, St. Jude had come up with Global Comfort Promise, They were already during in the first cohort, and they were continually running the project. But my mentor, being part of the same team, helped me guide through build up over the year that what I need to start doing things so that I can implement this project, get everybody from the administration, the pediatric oncology team, everybody to be on board with this plan. As I said earlier, being friends with them helped. And also, they resonated it because they felt that they want to do something about it, did not know how to do it. And they were equally helpless when I approached them with that particular topic. Everybody was on board. They felt that yes, that is the most important aspect that we really need to address, because they felt that that was one of the reasons why the children were not compliant. Parents would probably sometimes drop out of treatment or delay treatment because the child refuses to come to the hospital due to the experience, or just the overall anxiety would put the entire ward into one hazard environment, that one child, if it starts crying because a procedure is anticipated, everybody else around is anxious, worried, and that would delay a lot of other things as well. So that was my project, and I would say that having the administration also realized this, because the palliative medicine department at Manipal, it's part of a university teaching hospital, so they also felt that yes, the hospital needs pain policy. They were also in building pain policy for the hospital, that we can have guidelines for all the other clinicians. This was my right moment to tell them that this is something that we can start with. This is something which is achievable. It's a small project. If we were to do it in pediatric oncology and model it up for others, I think it can be really useful for even in application in pediatrics, in the NICU, in the PICU as well.
Wow, I love how you started very, very big and then brought it down to what is achievable, what is doable in the time period that I have. Also, you brought in multiple partners, your mentors, St. Jude's, Comfort Promise, your institutional support, your team itself, and then tried to do a pilot within a single department. And with those results, planning to scale it up to the rest of the pediatrics department. I really love that, Kritika. Any specific leadership skills or aha moments that you have when you were the scholar yourself?
Well, there were some of those things, but one of the things that really struck with me is in palliative care, we talk about, as we always say that, we are not giving up, we are an additional layer of support, and that we are, making things along the journey more beautiful, or rather, I would say we're adding life to the days that are left. The leadership journey also gave me that knowledge, that, or that idea that what I'm doing here, I do not want to give up on doing that. I need to start looking at how can I make it different? If this doesn't work, what else can be done that it still works in the way that I want it to, or towards what I want to achieve it? So that constant out of the box thinking is something what I learned from being a palliative care physician, dealing with so many different families and patients, and the way the lives that they come from, and trying to see how you can help them, had also helped me in the leadership journey. Whenever I had hurdles in my project about something's not working, somebody is not supporting, how do I navigate conversing with them? Can I put it across in a different way, that will convince them? So those are some kind of parallels that I can draw, is what I kind of learned in my leadership journey as well. Also, that it's not about authority. It's about how I can influence people, how I can bring collaboration of different stakeholders, and being persistent. Like, you have to just be persistent and keep doing it, because I see that when I see a lot of patients and I kind of manage their issues and, have conversations with families, change has never happened overnight. It happens over the trust that I have built, the rapport that I build, that shared purpose. So these parallels I draw from the palliative care training and as well as my leadership journey.
Fantastic. I hear innovation, persistence, flexibility, pivoting, a lot of the important skills to work in a space such as pediatric palliative care. Kritika, you are also one of the very few people who, after graduating from the leadership program, became a mentor in the next cohort. You, along with a few other faculty, have mentored other projects, programs, helped them successfully finish their projects. So, how has your experience shifted when you moved from the role of a scholar to a mentor? What was the other viewpoint that you were able to access because of this shift?
Oh, that was a very unique experience. I got to see both sides of the journey. And that transition, I would say, was incredibly transformative as such. Reason being that as a scholar, I was very focused inward. I was focused on my growth. I was learning new ideas, new frameworks of how things work, and developing those leadership skills. And as I moved in that journey as a scholar, I was gaining more and more clarity about my vision and how I can narrow it down to a more achievable task. So it was about more of self discovery, as I said. It was about me trying to figure out what kind of a leader do I want to be? How can I make meaningful change in the place that I'm working or in my context? So it was very challenging. At the same time, it was empowering for me as well because it made me step out of my comfort zone. And it requires a lot of, what I would say, it requires you to confront it's a lot of uncertainty and self doubt that can I or will I be able to? And how does it go? Let's figure it out. But when I became a mentor, it shifted my perspective to a different way that I realized that as a leader, it's not about having all the answers. You sometimes have to create space for others to grow as well. Because I would see the mentee approaching me, we would have a lot of discussions, sometimes even just being available over a WhatsApp message, or we would schedule calls. I realized that as I listened more deeply to them, I was involved in what they are bringing out of their project, discussing with me the smaller nuances. I learned that I would ask them more questions to make them think. What can work? What else can you do? Rather than me sitting down and say, hey, let's look at how we can solve this. I would rather make them think about it. And I also learned that all of them came with unique perspectives which was shaped with their, where they have worked, their experiences, how they have learned things along the way, and what they aspire to bring out of their project. So it was very reinforcing for me of what I had learned along my leadership journey. And at the same time, understanding different perspectives that others would bring in from their own experiences.
Thank you, Kritika. I think that is one of the most challenging skill to acquire is unlearning or leaving what we have already learned and listening as a blank slate and taking in what they have to say. And also sometimes just asking the questions, as you were saying, and listening to what was happening in their own space and watching as they come up with solutions themselves. That sounds fantastic. And I also want to say we at Two Worlds are incredibly grateful for all the work you have put into the leadership, not just as a scholar, but as also as a mentor, helping them, and now also with the Catalyst Lab phase. Thank you, Kritika.
And I really appreciated that. I mean, I really appreciate making me part of it because one of those things that really made me understand the efforts that the faculty had put when I was the part of the first cohort was I remember Megan had asked me to help her out with structuring the innovation hub for the second cohort's workshop. It was a maddening challenge. I was like, I'm not able to figure out how to make people be in various groups to get interviewed by 6 7 different donors out there. And it was a chaos in my mind, but I just met her and then she said, no, you'll figure it out. I leave it up to you, Kritika. I think you'll be able to manage it. Next day when the moment arrived and we had to do that part, we were able to finish it in the time frame. I was like, wow, I had really doubted myself and I did not know how to do it. And it just played flawlessly out here. And I was so thrilled. It was really enthralling for me to know that, a task was accomplished. But at the same time, it was so much of learning because I went through so many back and forth thinking about how do I place them? What do I do? Oh, this is not working. Let me figure it out. But in the end, it just went well.
It did not just go well. Between the doubt and the actual success, I think you put in a lot of work. And also, I really appreciate what you have brought out that mentor is someone who sees your potential before you can see your potential. And I think that is what Megan has done for you, which landed well. And that is very empowering. And that's what we hope to do with this work. Thank you. Thank you so much, Krithika, for spending the time with us. Thank you
It
for
has.
listening to this episode of the Sunflower Palliative Care podcast. These podcasts grew from the seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is Two Worlds Cancer Collaboration's pediatric care initiative. To learn more or to donate, please visit twoworldscancer.ca.